Carotid artery disease. What is it? What are the risk factors? And what are the treatments? Today, we're going to be talking with vascular surgeon Dr. Shane Palmer. He's going to tell us a little bit more about this disease and some of the treatments, again, that are out there for it. We're so excited to have you joining us today.
It's good to be here. Thanks for having me.
We are grateful to have you, in fact. So let's talk about it. What is carotid artery disease?
Well, carotid artery disease is essentially a variation of heart disease. Atherosclerosis, or plaque builds up in the artery. So the carotid arteries are the main arteries to the brain. And over time, as we get older and have various risk factors, which we'll talk about, that degree of plaque buildup increases, and as a result, also our risk of stroke can increase because the carotid arteries, since they feed the brain, they're one of the more common causes of stroke.
Who would you say is at risk for carotid artery disease?
Well, high-risk patients are typically those who have other medical issues, especially if you consider someone with heart disease or severe peripheral arterial disease. It's been estimated they're 4 to 5 times more likely to have strokes because they have significant carotid disease. Certain people with certain habits, smoking is without question the highest or most common risk factor for any vascular disease, especially carotid disease. And so smokers are much more common to have this. There are some genetic factors. Some people are more prone to it, be it due to early family of early heart attacks or strokes. Some diabetics, people with super high cholesterol, and of course, one thing I can't change is it's a disease of the elderly. So as we get older, your risk for developing this goes up considerably. But I spend a lot of time with the medical management of carotid disease. Not everybody needs surgery, not everybody needs to have it fixed. Really managing those risk factors, really getting them to stop smoking if they can, or even chewing tobacco, any kind of tobacco. Getting their cholesterol in check, getting their diabetes in check, all those things will lower your overall risk and maybe prevent surgery. If it gets to the point where you need to have something done, there are a couple of surgical options. Classically, we do what's called a carotid endarterectomy, which is a medical term for clean out the artery. A small incision in the neck, we open the artery up, we clean it out, and very well tolerated by most. I would say that's the gold standard for treatment. More recently, over the last decade or two, we've had increasing number of people getting stents, which classically, what we call transfemoral through the groin, kind of like a heart cath. That has a higher risk of stroke, so a lot of people have kind of lost favor of doing stents through the groin anymore. There are cases when you need to. More commonly, there's a new procedure out in the last 5 or so years called TCAR, T-C-A-R, transcarotid arterial revascularization, where you do a stent, but you go directly into the neck. It has a really elegant device to help prevent stroke, so it has a lower risk of stroke than the old way of doing stents. So most people do either the open, the endarterectomy, or the transcarotid stenting these days.
Absolutely. I want to talk about the risks for stroke as well. Having carotid artery disease, does that put you more at risk for stroke? How does that work?
Absolutely. So the reason we fix the carotid arteries is to decrease your risk for stroke. So the most common causes of what we call embolic stroke, which is a non-bleeding stroke, and the most common cause of stroke are either significant carotid disease or atrial fibrillation, which is an irregular heartbeat. Both of them are very common, and they're about 40% each as far as causes. So if you have significant carotid disease, your risk for stroke goes up based on how severe the narrowing is. The more severe the narrowing, the greater your risk of stroke. The other thing that actually increases your overall risk and goes into whether we talk about surgery versus medical management, if you come in and you've had a stroke. So sometimes it's preventing the first stroke, but the most important one is somebody who has a stroke, and if you have significant carotid disease that's the culprit, you have to fix it, because the risk for another stroke and or death in the next year is astronomical. And so that's the easiest thing I do, is make that decision. And so those are the most common things that really lead into whether we fix it or not. How severe it is because of the higher risk of stroke. And then if you've had a stroke, that shows that your plaque is, we'll just say, unstable. It has a tendency for chunks to want to break off, and that's how most strokes occur. Things break off and they go north. And then you fix it, you don't have that problem. Ideally, I'm more of a one and done kind of guy, if possible, but that's not always the case. As I tell my patients, nothing I do will last forever, unfortunately, because they can get re-narrowing in it, whether it's a stent or whether it's the open surgery that I do. We try not to put stents inside of stents. You start losing the diameter of the vessel, but both stents through the groin, transfemoral stents, or TCAR, if need be, they can be repeated. It's typically a rare occasion. Once you put a stent in, you can, if you have to, do it again. Most commonly in my practice, I lean towards the open surgery, as we mentioned, because most people do best with that. That has the proven long-term benefits. And if that re-narrows, which can occur, that's when TCAR really has great value. Because it's much harder to go back in and reoperate on those patients. My partner, Dr. Goudreau, who at some point hopefully you'll meet, and I are vascular surgeons. So if you look at those who do vascular surgery, and there are some non-vascular surgeons that do that, vascular surgeons are the only specialty that's specifically trained for all aspects of management. And so we're not necessarily pinned into only medical management or only stents or only open surgery. Dr. Goudreau and I can do all aspects, and that's what we provide at MUSC downtown. So we provide that, which is kind of different than a lot of facilities have, where they have maybe heart surgeons doing carotid vascular surgery or general surgeons. So if you can provide all aspects of care, then you can tailor it to whatever the patient's need is. And I think that sets us apart from most places.
Excellent. Well, Dr. Parmer, thank you so much for joining us and sharing these details. Is there anything else that you would like to share with our viewers when it comes to their vascular health or to this heart disease?
Well, the thing I tell all my patients, anytime somebody offers or recommends a surgical procedure, whether it's my office, whether it's a simple CAT scan or somebody else's ordering, always ask the questions. A lot of people just go along and have a procedure done, a test done. They don't know why they're having it done. You deserve to know why. They don't know how much it's going to cost, which sometimes is tough, but they don't understand what it's going to do to change their care. How are you going to use that information? If the answer is like, well, I'm not, then again, why should I have this study? What are the risks of it? And those are the things you need to ask. You need to ask the W's, because otherwise, you're having procedures done and there are risks to everything. And so I try to manage risks in my practice. And so I encourage all my patients to do that, whether it's vascular surgery or not.
Wonderful. And again, we'll be sure to have all these details on our website, sodacityliving.com. Dr. Parmer, thank you so much. We're going to take a quick break. We'll be right back with more.